You are very welcome to this video as always. Thank you for tuning in. Now, I think we've got good news today. The infection fatality rates seem to be going down quite steeply. Much fewer people seem to be dying from this pandemic than we had feared at the start. So that's the focus for today. And I also want to look at this 6% figure from the United States. It's been in a lot of headlines saying that only 6% of the deaths attributable to COVID-19 were actually caused by COVID-19. Now, to give you the bottom line, those headlines are wrong, but we will need to look at some detail to sort of explain that a bit. It's not a straightforward figure. But launching off with the UK in the United Kingdom, now estimating the infection fatality ratio in England. Now, this is the Centre for Evidence-Based Medicine in Oxford, so it's a reputable source, just published there on the 21st of August, so do check it for yourself. And it's saying infection fatality rate is falling over time. Now, you'll remember that the infection fatality rate is the number of people that die compared to the number of people that get infected. That's the infection fatality ratio, or the infection fatality rate, and of course we want the percentage to be as low as possible. Now, the Office for National Statistics in the UK, as of the 4th of August, they've taken all the data from the UK and they've calculated that it's just under 0.5%. Just under 0.5%. Now, we had feared much higher figures in the earlier stages of this pandemic, and it's quite a relief. And even that 0.49%, the vast majority of those people were older or had comorbidities. And as well as that, I think a lot of the most vulnerable people, this sounds a bit strange to say, but I think a lot of the most vulnerable people have died already. So that is relatively higher than we can probably expect it being into the future. But that's the figure so far as of the 4th of August. 0.49% is the infection fatality rate. And the Office for National Statistics are 95% sure that figure, that 0.49, falls between 0.36 and 0.67. That's what they think it is. And that's their possible range of what it could be. But that's kind of the best guess estimate, or not best guess, it's based on complicated, valid methodologies of analysis. But that's what they think, between that and that, but probably that. So that's from the Office for National Statistics. Now, the Medical Research Council, they have done this calculation. Okay, the data's a bit more out of date. It's as of the 28th of July, but not a lot. This is the latest data for which full analysis is available. And their figure is 0.3%. 0.3%. And their 95% is between 0.22 and 0.4 according to their figures. So these are lower infection fatality rates than we'd feared. And the vast majority of these are in older people. So it's not as bad as I thought this was going to be. I am somewhat relieved to make this video, to be quite honest. Now, as of the 23rd of June, the Medical Research Council thought the infection fatality rate was 0.69. But now they've recalculated that down to 0.3. So they've halved their estimate of the infection fatality rate, more than half. They thought it was 0.69. They now think it's 0.3. Now, if you click on this link here, I always post all the notes, of course, we can see some charts. And this shows that this reducing death rate is also reflected in reducing, this is hospital admissions. So this is like April here, and this is the 26th of August here. And we can see this is the hospital admissions for COVID-19 in the UK, falling off really dramatically. So many less people hospitalised as well at the moment, partly because there's less cases, of course, but not entirely because there's less cases. So that was I just wondered why I'd frozen up then, sorry. So that was the hospital admissions. And this was the critical care bed occupancy, also way down, and this is separate figures for England and yeah, that's the English figure there. That's the total figure there. Of course, the population of England is much greater than the population of Wales, Northern Ireland and Scotland. So this is the overall figure here in blue. And again, we can see that intensive care occupancy has dropped off really quite dramatically. So not only are we seeing less deaths, we're also seeing less hospitalizations and less critical patients so far. Having said that, there's a big proviso, and that is we've got next winter to go yet. That's the big proviso to this. But so far, this is encouraging, looking at that data so far. Now, this is the Centre for Disease Control. Their figures on deaths and comorbidities. And their data here is up to the 22nd of August. And we know that there's 161,000 deaths. Actually, of course, it's more now. This was the figure up to the 22nd of August, up to which this data is being analysed. And they're saying that for 6% of deaths, so of this figure here, only 6% of this figure, COVID-19 was the only cause mentioned. The only cause mentioned. So what a lot of the press have picked up on is this 161,000 figure is grossly inflated, and that the real deaths from COVID-19 is only 6% of that. That's what they've picked up on, but it's not that simple. It's 6% of this 161,000 cases, only COVID-19 is mentioned on the death certificate. Now, what this means is there is a lot of people dying who have comorbidities. And of course, the older you are, the more likely you are to have comorbidities. So this is telling us that most deaths, the vast majority of deaths, have been in older people with comorbidities. That's what it's telling us. But I think it's a very useful thing to go into, because it shows us principles that are going to be globally applicable in this pandemic. Now, of course, it's partly the way that a death certificate is written, of course, by the attending doctor who diagnoses death, or whoever's diagnosing death. It's partly what they write. But anyway, we'll go on. So for death with comorbidities, so where people had comorbidities, the average number of comorbidities was 2.6. So what this is saying is most people that died of COVID-19 had more than 2 comorbidities, more than 2 other conditions, very often in addition to being older. Now, what I thought it was particularly useful to know here is the cause and effect. So people are dying with other conditions written on the death certificate. Now, I think you can divide those conditions into 2 sorts. Those which are comorbidities that made death from COVID-19 more likely, and those that were directly caused by, and those which were complications caused by the COVID-19. In other words, did the comorbidity come first, or did the COVID-19 come first? You'll see what I mean as we go through, I think. Now, if we look at influenza and pneumonia here, 68,000 deaths. 68,000 of this 161,000 deaths had influenza and pneumonia. Now, most of the influenza deaths, of course, were early on in the pandemic, when we still had the tail end of last year's influenza outbreak, because we'll get influenza every year. Now, we are going to get influenza again this coming winter, and again that's going to cause deaths. But the way the statistics are gathered, influenza and pneumonia is clumped together. So influenza is independent of COVID-19, but the pneumonia can most certainly be caused by the COVID-19. So someone could get COVID-19 and that would cause the pneumonia, making pneumonia to be written on the death certificate. Having said that, pneumonia is a remarkably common cause of death. Most people, actually, I think it's true to say most people that die a natural death actually have a degree of pneumonia at the time of death if they've been immobile for some time. We used to call it hypostatic pneumonia, the pneumonia that people get just because they're not moving around, usually caused by bacterial infection. So that one could very much be caused by the COVID-19. So you can already see that if some of these cases of pneumonia were caught, if the pneumonia was caused by the COVID-19, then that's already making that 6% estimate look an underestimate, because the COVID came first. Chronic lower respiratory tract infection, well, that's a genuine comorbidity. That's a genuine comorbidity, because people have chronic means they've had it for a long time. These are conditions such as chronic obstructive pulmonary disease, but showing that people with this are more likely to die. Now, the ARDS, the acute respiratory distress syndrome, is the alveoli, these air sacs in the lungs, becoming inflamed and filling up with fluid, as we've done many times. That means the oxygen can't get out to the blood. and it means the carbon dioxide from the blood can't get back into the alveoli to be breathed out. It's very similar to the presentation in pneumonia, but this is very much caused by the COVID-19. So the ARDS comes after the COVID-19. So again, that increases the 6% because that's the complication of COVID, as is respiratory failure, as is respiratory arrest. Now, these things are going to be more likely in people with predisposed respiratory conditions, but these can all be caused by the COVID. So again, that's going to increase the 6% figure. Now, moving on to cardiovascular, moving on to cardiovascular causes. Where have I gone? There I am. Right. Cardiovascular comorbidities here. Now, high blood pressure is a classic one. Again, the high blood pressure comes first. It's not secondary to the COVID. Likewise, the ischemic heart disease. Ischemic means not enough blood getting through the coronary arteries to the myocardium. So again, that came first. Cardiac arrhythmias means the heart's not beating regularly, and that could be cause or effect. Heart failure would normally come first, and cerebrovascular disease means where the blood supply to the brain is inadequate. That would normally come first as well. Now, sepsis can very much be caused by the COVID-19. Malignancy would be already in place, malignant neoplasms, cancers in other words. Diabetes would be already in place, obesity would be already in place, Alzheimer's and other dementias would be already in place, but renal failure could be partly caused by the COVID-19. So what we see is the way things are written on the death certificate, they are partly comorbidities that patients could have had for years, but they're also partly things that can be caused by the COVID-19. So what that means overall is that 6% figure does not mean that only 6% of these people had actually died of COVID-19. It doesn't mean that, unfortunately. Great if it did, but it doesn't mean that. But it does mean that quite a few people, well, as we've seen, 2.6% of people, of the people that die of COVID-19, the average comorbidity is 2.6 of these conditions. So it means that the vast majority of people dying have these comorbidities, and very often associated with increasing age. Now, other conditions that were mentioned by the Centre for Disease Control, injury or poisoning, whether deliberate or accidental, and others. These are the dozens of other conditions that can all contribute as comorbidities, but are less easy to identify. So I thought that was quite useful. So we've got these lists here: the respiratory, the cardiovascular, and the metabolic comorbidities. So I thought that was quite useful. Now, moving on to England. Care homes in England had the greatest increase in excess deaths at the height of the COVID-19 pandemic. Now, this is data from Stirling University, which of course is in Scotland. So Stirling University in Scotland have collected this data and just published it in the past few days actually. Now, what they found was, of all deaths registered as COVID-19 related in the UK, this many here, 17,127, 31%, occurred within care homes, actually on the premises in care homes. But 40% were care home residents, meaning that some of the poorer residents had been taken to hospital but still died. So basically 40% of the people that died from COVID-19 at the height of the pandemic, and actually no, these are overall figures. This is overall, sorry. We're coming on to figures that are specific to the pandemic. These are overall figures. 40% of the people that have died in England have been care home residents. So a very high figure for care home residents. Now, Scotland had the highest proportion of care homes affected in terms of percentage of care homes affected, so that's bad news. And they had the highest proportion of care home deaths attributed to COVID-19, but these were patients who were officially diagnosed. That's what this study from Stirling was largely about. So this is Professor David Bell and his team in Stirling. There I am. Trouble with the technology today. Now, what they looked at was not the official diagnosed deaths from COVID-19, but the number of excess deaths altogether. Because variations in testing are going to greatly vary the number of deaths that are attributed to COVID-19. A more accurate figure, he says, is the number of excess deaths altogether. So at the height of the pandemic, in care homes, 79% of excess deaths, in other words, deaths were 79% higher than they would normally be in England, 66% in Wales, higher, 66% higher in Scotland, only 46% higher in Northern Ireland. So by those figures, we can see that Scotland seems to have more cases diagnosed, but England probably had more deaths in reality. And of course, this reflects the whole global situation. We're never going to know how many people died in this pandemic because so little data has been collected in so many parts of the world. So in David Bell's words, it will never be possible to unequivocally assign care home deaths during the pandemic to COVID-19 or other causes. That data is now lost. And I've paraphrased him here by saying excess deaths is the next best thing to the real data, and it probably is. So let's now look at the situation in Europe in terms of graphics and death rates. Now, this is the cases. So we can see that the cases in Spain are nearly where they were at the height of the pandemic. Not quite, but nearly there. In France, again, that's the top of the French curve during the pandemic. And the cases in France now seem to be higher in terms of daily cases. But how does this reflect in death rates? Well, these are the death rates dropping off dramatically. In fact, we can't even see that on this linear scale, where there's equal numbers of gaps there. So we have to go onto the log scale to make any sense of it, the logarithmic scale. And the log scale, that's 1, then that's 10 times that, then 10 times that, then 10 times that. That's the log scale. So we've got this annoying blip in the data here in Spain, just the way they collected it, so ignore that. But we see that the death rates in Spain, despite greatly increasing cases in Spain, the death rates aren't that high. So the death rates are around about, on average here, we see they're about 13 deaths a day in Spain. France, a little bit lower, maybe 12. Spain's probably 14, actually. United Kingdom and Germany. So in Germany we're only seeing, I know we can't say only deaths, they're all deaths, but nevertheless compared to what it was, I mean, when you think about it, the deaths here were around about 1,000 a day because this is a logarithmic scale. Now they're down around about just over 10 a day, or just in the case of the United Kingdom 10 a day pretty well exactly, and in the case of Germany under 10 a day. So interesting data there from Europe. Let's look at the similar data from the United States as well. Now the news is not quite so good in the United States, it has to be said. If I can get the United States data for you. Yes, there we are. Now here in the United States, these are the number of new daily confirmed cases. So we see it is dropping off. Still quite high, of course, still well over 40,000 new cases per day. So we're still getting an awful lot of accumulated new cases in the United States. But death rates, they're not dropping off as much as they are in Europe. So in Europe, the death rates are dropping off a lot more, but they are reduced in the United States. So at the peak, we were looking at well over 2,500 deaths a day. Now we're down to somewhere under 1,000 deaths a day. So the reduction in the United States, nowhere near the reduction in Europe, but still heading in the right direction. So it's still fairly encouraging reductions that we're seeing in death rates. Now, the big proviso to all this is we've still got to survive next winter. Next winter, there's going to be schools are going back, more spread in young people. That's going to spread to older people, and more of those are going to die. There's a lot of deaths still to come in this pandemic. What we don't know is how many. I am concerned about next winter. The factors are well known: the lack of vitamin D, crowding together in small areas to keep warm, reducing the ventilation. Ventilation is just absolutely key to this. We need to open the doors and windows and reduce the viral load. People are considering various public meetings again, and they say wearing masks and socially distance and hand hygiene, but so many people don't get the simple necessity to open the doors and windows and have a through draft. Tell everyone, because that's going to lower the viral load. That's the big thing we need to do. Now, just to finish today, the other thing about death, so I wanted to sort of contextualize this. Now, yesterday we looked at this data here. As you can see, my squiggles from this are here from yesterday. And we looked at the global deaths from COVID-19 so far in 2020. But these are the deaths from influenza typically that we know of, around about 500,000. So there are more deaths from COVID-19 already than we'd have in a typical flu season. But we also looked at the effects of influenza in many poorer countries that simply aren't known. And tragically, and this is appalling, and I said it yesterday, I'll say it again today, 99% of deaths in children under the age of 5 years that are due to influenza occur in developing countries. Quite outrageous. All the factors that are there, the nutritional factors, the clean water supply factors, the poor accommodation factors, the lack of medical care, the lack of antibiotic factors, so many things that we can explain that by, and yet the world is apparently quite happy to allow 99% of deaths of 99% of deaths in children attributable to influenza to carry on in the third world countries, whereas in the UK, in the States and richer countries, it's 1% of people, 1% of children die, but 99% of children, 99% of the total deaths that occur are in poorer countries. It's an appalling indictment. But the point I'm making is we have to contextualise the amount of deaths. So we see that, probably we're around getting on for double the amount of deaths from COVID-19 compared to a typical influenza pandemic season. And influenza is pandemic, of course. The influenza A's, they do spread around the world. They are actually pandemics. So it's true to say we have a pandemic of influenza every year. That is basically true. Some years a lot worse than others. 300,000 to 650,000 deaths approximately. But what I want to do today, just to finish, is to contextualise the death rates in terms of something else, and that is smoking. Now, in 1948, the famous British physician Richard Doll, with his mate Austin Bradford Hill, worked out that smoking caused lung cancer. Now, Richard Doll had smoked about 10 cigarettes a day before that. He looked at this data. In 1948, he stopped smoking. So Richard Doll stopped smoking in 1948. They published that data in 1950. Now, what we could do, I'd have to do a bit of prep, but I've looked at this before. We could look at the long, sad story of deceit, lies and manipulation as invested interests tried to deny the simple fact of science that smoking causes cancer. For decades, people tried to make money by suppressing that simple truth. And then, of course, later on in the 60s, 70s, we also learned that smoking caused ischemic heart disease. Big time. Smoking is a massive factor in ischemic heart disease. And we see so many less myocardial infarction type heart attacks now than we used to when I worked in coronary care 30 years ago. Actually, just over 30 years ago, but never mind that. So let's look at smoking as a comorbidity. Now, 7 million deaths a year occur from smoking. COVID-19 deaths so far have been under 1 million. And it's estimated that by 2030, in the next 10 years, if smoking trends increase, that will go up to 8 million. Now, the tragedy about smoking is as less people smoke in Western countries, more people are starting smoking in poorer countries. Tobacco interests have been advertising their wares in poorer countries, attempting to, well, that they would say attempting to convert people to their brand is probably what they would say. So, I mean, I was doing a job in India a few years ago, and it was appalling how many people smoked, especially the poorer people. It's they can get tobacco very cheaply, and a lot of people smoked. Because in the UK now, very few people seem to smoke. You know, it's not that common, and we'll see the figures for that. Anyway, so that's the global scale of the problem. So remember, 7 million people are going to die in 2020, have died already, or will die in 2020 of smoking related disease, as opposed to, I mean, of course, we know the real number from COVID is way higher than that, but these are official figures. Now, England and Wales, the last full data set is available for 2017. 14.4% of adults smoked. Now, remember the COVID deaths so far in 2020. The Office for National Statistics figures is 41,000. In England and Wales, mentioned on death certificates, it's 52,000. Therefore, the real number for deaths in the UK is probably about 60,000. So probably about 60,000 deaths caused by COVID-19 in the UK in actuality. That number's too low because you have to be tested to get on that number. And you have to now have died within 28 days of being tested. Whereas that is when it's mentioned on the death certificate. So that's for England and Wales. So let's say about 60 million cases, but smoking related deaths in the UK, 78,000 nearly. 16% of all deaths are smoking related. And yet only 14.4% of the population are smoking. So what's going on here is that people are dying now as a result of cigarettes they smoked 10 years ago, 20 years ago, 30 years ago, 40 years ago, 50 years ago. We are paying the debt occurred, or the debt accumulated by decades of smoking. So that's what's happening. The death rates from smoking will continue to go down, of course, because the numbers of smokers are going down. So at the moment it's 14.4% of the population, 14.4% smoking. And yet still, because of the excess smoking that used to occur. I mean, in 1950, when the medical journals first published the information on smoking and lung cancer, 80% of the male population in the UK smoked. 80%. Women, it probably wasn't that much lower actually. Women tend to smoke on the quiet, you know, so it's probably, I don't know the figures for women, I'd be speculating, but it probably was 50, 60, 70%, that kind of figure. But it was 80% of men used to smoke in 1948. And that's now down to 14.4% of adults. So just a comparison of the number of deaths, really. Now, Australia, 11.6% of the population smoke. COVID deaths so far, 652. Smoking-related deaths, 21,000, 12.5% of all deaths in Australia. Now, again, the Australians have heeded the public health message better than the Brits. 14.4% of Brits smoking, 11.6% of Aussies smoking. So well done. Still 11.6 to go, Australia. 11.6% to go, but you've done better than the UK. And again, the 21,000 smoking-related deaths in Australia can in large part be attributed to smoking of previous years and indeed decades. The message is always the sooner you stop smoking, the better. Now, in the US, 13.7% of people still smoke, of adults, so a bit lower than the UK. COVID deaths, 183,000 so far in the United States. Smoking-related deaths, 480,000 per year. This is actually based on 2018 data, so it's a bit out of date, but it's probably a little less than that now but that kind of shows the influence of other health factors. 480,000 deaths from smoking, so far 183,000 deaths from COVID-19. 41,000 deaths in the United States from passive smoking, and 16 million people living with a disease caused by smoking in the United States. So I just wanted to put the deaths from COVID-19 into that perspective. The deaths are going down, and that puts it into the perspective of the influenza deaths every year and the smoking related deaths. Now all I need to do now, I've accumulated a few pictures of you good people, so let's look at those. This is Benjamin, who lives in Louisiana, and it looks like he's taking 25 micrograms of vitamin D a day, and we know that 25 micrograms of vitamin D is 1,000 international units. So good picture, Benjamin, thank you. This is Jody and Carol, who are staying one, now what do you call that critter? Is it a mountain lion or something? Anyway, I wouldn't mess with it, whatever it is. Jody and Carol, if you see one of those, I wouldn't get any closer. But it's a good amount to stay apart. So good, thank you for that, Jody and Carol. Some people are staying a big fish apart, and other people are staying an eagle apart. So all good. Social distancing is going to remain absolutely important until this goes away, when the vaccination program is well established. This is I'm not sure, I've just got this down as M, but it's a new lifestyle. So squirty in the car, which is good for keeping hands clean. Now, I think it might be, is it Martin? I think it might be Martin. Wearing his mask, of course. Oh no, the one in the car wasn't Martin. This is Martin. That's his local testing centre. Doesn't look very busy, Martin. Don't know what's going on there. This is the new lifestyle with the squirty in the car and some masks in the car, of course. Keep them to hand. This is the car as well. This is for wiping down surfaces. Also a good idea. And masks with the with the key rings, which is also good. This is Peter. Now, where do you think Peter might be from? Just wondering. A bit hard to tell from that picture. Great picture, Peter. Thank you for sending that in. Always appreciate our viewers across the pond. Always most welcome. This is Sally, who is English but works in Bahrain. So very good protection there, face shield and mask. Now, I was listening to someone on the news today, and it was a flight from, I think it was somewhere in, it was Zante, Zakynthos, the Greek island. She was flying back, and she said people weren't wearing the mask properly. So people wearing masks under the chin, under their noses, on their foreheads. And they were walking up and down, taking the masks off and having conversations with people. I mean, this is just ridiculous. Masks have to be worn over the mouth and nose properly. And these face shields are an extra protection that will give some additional protection as well. So, glad to see that is, and it's looking, this chap here, for example, again, wearing his mask properly. So this is, you know, and I'm pretty sure the airline people have greatly improved. Could you see that? Sorry, I'm pretty sure so that's the chap there wearing his mask properly. I'm pretty sure the airline people have significantly improved their filtering. I think things are a lot safer on aeroplanes than they were. Still a closed environment, of course, and obviously that person from Zakynthos had a bad experience because people weren't doing it properly. So it does depend on people complying with these what we now should be common sense regulations. Sally again. And I think that is us for today. So just to summarise this video, infection fatality rates are much lower than I'd feared at the start of this pandemic. They're much higher in people with comorbidities. They're much higher in the elderly, as we know. The average person that died of COVID-19 in the United States had 2.6 comorbidities. So older people and people with comorbidities, especially multiple comorbidities, need to be much more careful and guard themselves. It will only be till next year when we get a vaccine. And my belief still is that this pandemic, this virus is going to go away. Once the vaccine's there and the immunity is there, I do not believe it will become endemic. I still believe we can get rid of it entirely, but it's not going to be in 2020, that's for sure. Thank you for watching, as always.